Start. So, good morning, students. So, in the last class, we have discussed about the benign lesions of the larynx. So, can anybody answer what is contact ulcer? What is contact ulcer? Is it ulcer? What is a contact ulcer? Can anybody answer? Am I audible to all? What is a contact ulcer? No answer. Yes, it is pseudo ulcer. What is a contact ulcer? What is the name given for the contact ulcer? What is the name given to the contact ulcer? Pachyderma. Pachyderma laryngitis. Excellent. 17807030. What is your name? 1730. Pachyderma. Your name, not pachyderma laryngitis. What is your name? 1780. Silusha. Wonderful. So pachyderma laryngitis is called as contact ulcer. So name of the contact ulcer is pachyderma laryngitis. Okay. So now we'll discuss about the papilloma larynx. We'll discuss about the malignant lesions of the larynx. So first one is squamous papilloma. What is squamous papilloma of larynx? So what is papilloma? What causes papilloma? What causes papilloma? What virus causes papilloma? Laryngeal papilloma. Can anybody guess? This human papilloma virus. So what are the strains of which are benign in human papilloma virus? What strains are benign in human papilloma virus? 6 and 11. What are malignant strains? 6, 11. What are the malignant strains of human papilloma virus? What are the malignant strains? Yes, 16, 18. Silusha, 7023. Is it Silusha? Okay. So, human papilloma virus, the benign is 611 and malignant is 16, 18. So, apart from laryngeal papilloma and carcinoma larynx, what are the other tumors which will be associated with human papilloma virus? Apart from carcinoma larynx, what are the other malignancies? Cervical cancer, excellent. Cancer cervix, inka. What else? Carcinoma penis. Carcinoma penis. So most of the genital organs, most of the raised hand. What's the problem? Why did you raise the hand? So most of the genital malignancies like carcinoma penis, carcinoma genital tracts like cervix, carcinoma cervix, carcinoma vulva, carcinoma cervix, carcinoma penis, and carcinoma anus will give rise, is caused by a virus called as human papilloma virus. So what are the names of the vaccines which we can give to the child to prevent development of cervical cancer? What are the vaccines we can give? What are the vaccines we can give? Gardasil and what are the other vaccine? Cervarix. Cervarix contains 16, 18, whereas Gardasil is a pentavalent vaccine which contains 6, 11, 16 and 18. So these are all the important bits which you have to remember regarding the malignancies. So what are the bacteria which causes carcinoma stomach? What is the bacteria associated with carcinoma stomach? CA stomach. H. pylori. Excellent. What is the virus which is associated with the Burkitt's lymphoma? What is the virus which is associated with Burkitt's lymphoma? Excellent. Epstein-Barr virus. Then what is the virus which is associated, which Epstein-Barr virus causes which type of Hodgkin's lymphoma? 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 Is it nodular? Is it predominant? Lymphocyte predominant? Is it lymphocyte depletion? Excellent. It is nodular. So Epstein-Barr virus and HIV, Epstein-Barr virus causes nodular type of Epstein-Barr virus, not nodular. It causes mixed cellularity. So HIV and Epstein-Barr virus causes mixed type of Hodgkin's lymphoma. So these are all the bacteria and virus which causes malignancies. So we'll talk about the papilloma. So it is caused by human papillomavirus 6, 11, 16, 18. And juvenile papilloma compared to adult papilloma, what is the difference? Juvenile papilloma is multiple. Juvenile papilloma has multiple papillomas, whereas adult papilloma has a single papilloma. So juvenile papilloma has multiple papillomas of the larynx, whereas adult papilloma has a single papilloma. Juvenile papilloma is a non-malignant. That juvenile papillomas are non-malignant. They don't lead to malignancy. Whereas adult papilloma, which is a single papilloma, will lead to malignancy. So these are the difference between the juvenile papilloma and adult papilloma. So juvenile papilloma and adult papilloma. Okay, excellent. No recurrence, no spontaneous resolution in adults. Okay, so in the juvenile papilloma, there are multiple papillomas. Which shows recurrence. Okay, which shows recurrence, and this juvenile papilloma will never lead into malignancy. Whereas adult papilloma, they are single. It will lead to malignancy, and there is no recurrence. So no recurrence. There is chance of malignancy. Single papillomas are characteristic feature of adult laryngeal papilloma, whereas multiple laryngeal papillomas, which has a tendency to recur even after surgery and which has no malignant potential, is a juvenile laryngeal papilloma. So if you know these points, you can answer completely anything regarding the papilloma of the larynx. So adult is single, does not recur, whereas juvenile papilloma are multiple, aggressive, they are resistant to treatment and recurrent. But juvenile papilloma never turn into malignancy, whereas adult papilloma has a malignant potential. So any disease in the larynx, what you will expect, what the problems you will expect in the carcinoma larynx? Simple. The symptoms are hoarseness of voice, because this laryngeal papilloma will obstruct the laryngeal inlet. It obstructs the laryngeal inlet, causing hoarseness of voice. So this laryngeal papilloma can involve the anterior commissure. It can involve the anterior vocal cords. Mostly the location is in the anterior part of the larynx. It can involve the anterior vocal cord. It can involve the anterior commissure. It can involve supraglottis, glottis, and subglottis. Any structure it can involve. It can involve supraglottis, glottis, and subglottis. Okay, excellent. Stridor, hoarseness of voice, stridor. Yes, they are the symptoms of the laryngeal papillomas. So students, see, this is the adult type of juvenile papilloma, where you are seeing a single papilloma at the anterior commissure. This is the anterior commissure, where these vocal cords are attached anteriorly to the laryngeal cartilage. It is called as anterior commissure. So it is present at the anterior commissure. It is single. It's a single laryngeal papilloma. Single laryngeal papilloma, which has malignant potential, which does not recur, is a characteristic feature of adult onset papilloma. It's a characteristic feature of adult papilloma. So this is the multiple papillomas arisen from the tracheal involvement, arisen from the trachea. So what you can expect? Why is it a juvenile or adult? Multiple papillomas are there. Are they juvenile or adult? Any answer? Yes, it is a juvenile. Then why you are expecting? I am saying the most common site of papillomas are from the supraglottis, glottis, and subglottis, which involves the larynx. But why I am saying here that there is tracheal papillomas? What is the etiology? What you can expect? Why there is papillomas in the trachea? What you can expect? Just use a sense, common sense. Why it is getting in the trachea? Any reason? It occurs in a patient who had a tracheostomy. So the patient who is having tracheostomy, the larynx arises at the site of tracheostomy. So this is called as tracheal papillomas, not laryngeal papillomas. It's called as tracheal papillomas. So what is the surgery? Microflap surgery. Previously we have discussed this microflap surgery for vocal nodules. We have discussed. So just to elevate the flap, that is the epithelium of the larynx, and we are removing this papilloma, and we are trimming the remnant flap and you are approximating it on the remnant of the vocal cord. This is called as microflap surgery, cup forceps surgery, and microdebrider. We can use an instrument which is called as microdebrider. By using this is the microdebrider instrument. This is the forceps instrument. By using the microdebrider instrument, we can chop this papillomas into tiny bits. We can chop the papillomas into tiny bits. I'll ask you one question. What are the causes of juvenile laryngeal papillomas? What the cause you can expect? What cause you can expect during delivery? During delivery, how the chance of getting the child is chance of getting the papilloma, not juvenile papilloma, congenital papilloma. How? Yes, excellent. It is because of vulval or vulval polyp papillomas. This vulval or vaginal papillomas during the delivery may give rise to papillomas in the newborn. So genital warts or genital vulva has a transmission of human papilloma virus from the mother genital tract to the child, giving rise to laryngeal papillomas. Okay, excellent answer. What is this person name? Not transplacental. It is through birth canal. So 17807094. What is your name? 17807094. What is your name? Okay, tell me later. Bindu, yes, nice Bindu. Huh? Good answer. So we have completed the benign lesions of the larynx. And if they ask about the chondroma, what is chondroma? From which side you can expect the chondroma to arise? The chondroma may arise from cartilage. Chondroma arises from cartilage. So what is the most common site of chondroma from where you can expect the arisal of the chondroma? What is the most common cartilage which gives rise to chondroma? It's cricoid cartilage. Excellent. It is cricoid cartilage. So not thyroid, it is cricoid cartilage. So these points are very, very important. What we have discussed is very, very important. It will be asked in many questions, many entrance bits, and it can be asked in the undergraduate examination also. So after completion of the benign lesions of the larynx, let us discuss some questions. I'll ask you some questions. Please answer. So what is the most common site of vocal nodule? What is the most common site of vocal nodule? Vocal nodule. What is the most common site of vocal nodule? What is the most common site of vocal nodule? The junction of anterior 1/3 and posterior 2/3. Okay. Where you will see Boyce's sign. Boyce's sign. Where you see Boyce's sign. Boyce's sign is a characteristic feature of Valsalva. Okay. Where you will see the Boyce's sign? Laryngocele. Excellent. We will see it in a laryngocele, Boyce's sign. Boyce's sign, in which type of laryngocele you will see Boyce's sign? Which type of laryngocele you will see Boyce's sign? In which type of laryngocele you will see Boyce's sign? No, we will see it in the combined laryngocele. We will see it in the combined laryngocele. That is, the combined laryngocele will have communication with the larynx. So when you compress the laryngocele externally, there will be escape of the air in the larynx, creating a hissing type of sound, which is called as Boyce's sign. Then what is Bryce sign? What is Bryce sign? Where you will see Bryce sign? Where you will see Bryce sign? Bryce, B-R-Y-C-S. Yes, it is juncus diverticulum. Is it a true diverticulum or false diverticulum? Juncus diverticulum. Is it a true diverticulum or false diverticulum? Then what is the true diverticulum of the larynx? What is the true diverticulum of larynx? What is the true diverticulum of the larynx? This true diverticulum of the larynx is middle. What is the name of that? Paraesophageal. It is also called as tractional diverticulum. It is also called as tractional diverticulum. What juncus diverticulum and epiphrenic diverticulum both are what type of diverticulum? What type of diverticulum are these both? Juncus, false diverticulum, excellent. Apart from that, what is the name given to it? It is seen in, it is called as pulsion diverticulum. Okay, it is seen in pulsion diverticulum. Pulsion diverticulum. Okay, okay. Next question. So where you see omega like epiglottis, omega epiglottis. Where you see omega like epiglottis. Where you see omega like epiglottis. Children, where you see omega like epiglottis? Laryngeo Malaysia. Excellent. Where you will see turban epiglottis. Turban epiglottis. Where you will see turban epiglottis. These are the larynx. TB. T for T. T for T. T is turban epiglottis. Okay. Turban epiglottis. T for T. Understood? T for T. So TB in tuberculosis, which is the most common GAT. What is the most common GAT site for tuberculosis? GAT tuberculosis. It is ileocecal junction. Ileocecal junction. You will see what type of ulcers in the distal ileum. What type of ulcers you will see in the distal ileum? Is it longitudinal or transverse ulcers? It is transverse ulcers. Whereas in typhoid, you will see longitudinal ulcers. In typhoid, you will see tie longitudinally. So in typhoid, you will see longitudinal ulcer. Whereas in TB, you will see transverse ulcers. Okay. Next, where you will see thumb sign. Thumb sign. Which type of laryngeal disease? You will see thumb sign. Thumb sign is a characteristic feature of, excellent. Thumb sign is a characteristic feature of acute epiglottitis. So acute epiglottitis will show thumb sign. On which imaging? What image? In which image you will see the thumb sign? Image lateral what? X-ray neck, lateral view. You will see a thumb sign in case of acute laryngitis. Then what is CROUP? What is full form of CROUP? C-R-O-U-P. CROUP means what? CROUP. C-R-O-U-P. Excellent. It is acute laryngeotracheobronchitis. There is inflammation of the larynx, inflammation of the trachea, and inflammation of the bronchitis. Bronchus. It is called as laryngeotracheobronchitis, which is also called as CROUP. Which is called as CROUP. Okay. So students, is nice answering, good answering. So next we are going to discuss about the carcinoma larynx, but it takes more time. So we will discuss the carcinoma larynx in the next session. But before discussing the complete aspect of the carcinoma larynx, I am going to tell you some important points and silent features of the carcinoma larynx. So carcinoma larynx, in which age you can mostly expect the carcinoma larynx? In which age group? In which age group? Yes, excellent. It is 50 to 70 years. Exclusively, mostly, not exclusively, mostly. In which gender you can expect the carcinoma larynx? Mostly. In which gender you can expect the carcinoma larynx? You can expect the carcinoma larynx in the males. You can expect the carcinoma larynx in the males. Okay. Can you tell me the ENT disease which you will see exclusively in females? One syndrome is there which you can see exclusively in the females. If there is iron deficiency anemia, you can see exclusively in female. Excellent. It is Plummer-Wilson syndrome. So what is the other name of Plummer-Wilson syndrome? What is the other name? What is the other name of Plummer-Wilson syndrome? Patterson-Killy syndrome. Excellent. It is Patterson-Killy syndrome. So which type of deficiency will give rise to this type of Patterson-Killy syndrome or Plummer-Wilson syndrome? Which deficiency? Is it megaloblastic anemia, vitamin B12 deficiency, or thiamine deficiency, vitamin B1, or is it iron deficiency, or it is folic acid deficiency? It is the iron deficiency anemia. So not vitamin B12, it is iron deficiency anemia. So iron deficiency anemia gives rise to Plummer-Wilson syndrome, which is also called as Patterson-Killy syndrome. We have koilonychia. And apart from koilonychia, we have what features? Post-cricoid web. Post-cricoid esophageal web. Along with koilonychia, iron deficiency anemia. Iron deficiency anemia Not esophageal varices, not esophageal varices. It is esophageal webs. Esophageal varices is different. Where you see esophageal varices? Where you will see esophageal varices? There is a portal hypertension. You will see the esophageal varices. Cirrhosis of liver causing portal hypertension. Then you will see hemorrhoids and splenomegaly with what? With esophageal varices. Okay, with esophageal varices. So in Plummer-Wilson syndrome, you don't see the esophageal varices. In Plummer-Wilson syndrome, you will see the post-cricoid web. So one sign is absent. One sign is absent on moving the larynx sideways. What is that called as? What is that called as? Bocas sign. So if the laryngeal crepitus is absent, it is called as Bocas sign positive. So Bocas sign positive is seen in post-cricoid web, and Bocas sign positive is seen in carcinoma cervical esophagus, and Bocas sign is seen in carcinoma pyriform sinus extending into the post-cricoid region. And apart from that, in one inflammation, we will see Bocas sign positive. That means absent laryngeal crepitus, in which infection we will see Bocas sign negative. We will see in the retropharyngeal abscess. So anything which obstructs the media between the larynx and this is the vertebra, cervical vertebra. Any media which obstructs the space between the larynx and the vertebra will give rise to absent laryngeal crepitus, which is called as Bocas sign. So Bocas sign negative means, Bocas sign positive means there is absent laryngeal crepitus. Bocas sign positive means there is absent laryngeal crepitus. Okay, so in CA larynx we have carcinoma subglottis, carcinoma glottis, carcinoma supraglottis. So first you have to know the basic anatomy. What is supraglottis? From where to where you will call it as a supraglottis. What is supraglottic structures? Can anybody? Usha. What are the structures? No, not until the vocal cords. That is not the correct answer. Any correct answer? Not from the hyoid bone. From epiglottis to the, not up to the true vocal cords. I want the exact answer. From the epiglottis to the floor of the ventricle. What is the name of the ventricle? Other name of the ventricle. Ventricle other name enti? What is the other name of the ventricle? Saccule. So from the floor of the ventricle up to epiglottis is called a supraglottic tumor. So if they say that tumor epiglottis is what type of tumor? Supraglottis, glottis or subglottis? Tumor epiglottis. Epiglottic. Carcinoma epiglottis. It is supraglottis. Carcinoma epiglottic fold. Carcinoma epiglottis is supraglottis or glottis or subglottis? Supraglottis. Carcinoma ventricle. Is it epiglottis or supraglottis? It is supraglottis. Then carcinoma pyriform sinus. Is it supraglottis, subglottis, or carcinoma glottis? Carcinoma pyriform sinus. Anybody? Twisting question. No, not supra, not sub, not glottic. No. Carcinoma pyriform sinus. CA pyriform sinus. Is it supraglottic tumor? Is it subglottis or glottic tumor? Anyone? No, I am waiting for the answer. Carcinoma pyriform sinus. Carcinoma pyriform sinus. Excellent. It is a carcinoma hypopharynx, not hypolarynx. It is carcinoma hypopharynx. So carcinoma hypopharynx is carcinoma pyriform sinus. So your carcinoma epiglottis, carcinoma false vocal cords, carcinoma floor of the ventricle, carcinoma epiglottic folds. They are supraglottic tumors. Carcinoma erythroid, they are supraglottic tumors. Then what are glottic tumors? What are the glottic tumors? What is the CA glottis, carcinoma glottis? What is carcinoma glottis? And it arises from the true vocal cords. Is a carcinoma glottis. Then what is carcinoma subglottis? Carcinoma subglottis. Anything arises from the lower border, lower surface of the vocal cords, anything arising from the lower surface of the vocal cords to the lower border of the cricoid cartilage, till the lower border of the, anything arises from the lower surface of the vocal cords to the lower surface of the cricoid cartilage is called as carcinoma subglottis. So if they say carcinoma supraglottis, carcinoma glottis, carcinoma subglottis, you must be able to tell easily that what is carcinoma glottis, what is carcinoma subglottis, and what is carcinoma supraglottis. Name the carcinoma which easily spreads to the paraglottic space. Is it carcinoma supraglottis or carcinoma subglottis or carcinoma, carcinoma epiglottis, or is it carcinoma ventricle, or it is carcinoma vocal cords or carcinoma subglottis, which easily spreads to the paraglottic space? Answer. Somebody answered previously. It is carcinoma ventricle. Excellent. Why? Why I am asking? Why it is spreading into the paraglottic space easily? See, paraglottic space boundaries are laterally it is bounded by the thyroid cartilage, and superior medially it is bounded by the quadrangular membrane, and inferior medially is bounded by the cricovocal membrane. Between the quadrangular membrane and cricovocal membrane, there is a space. That means between the false vocal cord and true vocal cord, there is a space called as ventricle. This ventricle is not lined by either quadrangular membrane or cricovocal membrane. It is just lined by the mucous membrane. So any tumor in the ventricle has a chance of spreading laterally into the space, which is nothing but a paraglottic space, because which spreads laterally, that is, it enters between the thyroid cartilage and between the quadrangular membrane in cricovocal membrane. Between these three structures it enters. These three structures forms the paraglottic space. So carcinoma ventricle is the earliest tumor which first spreads to the paraglottic space. Okay, then where does the epiglottis carcinoma spreads? Which space? Epiglottis carcinoma easily spreads into which space? Is there any space that epiglottic carcinoma can spread? It spreads easily into a space anteriorly called as preglottic space. So what is the boundaries of the preglottic space? The boundaries of the preglottic space are: superiorly it is bounded by hyoepiglottic ligament, superiorly. Inferiorly it is bounded by thyroepiglottic ligament. Anteriorly it is bounded by which membrane? Thyrohyoid membrane. And posteriorly it is bounded by the epiglottis. So pre-epiglottic space is bounded superiorly by the hyoepiglottic ligament, inferiorly by the thyroepiglottic ligament, anteriorly by the thyrohyoid membrane, and posteriorly by the epiglottis. This forms the boundaries of the pre-epiglottic space. So your carcinoma epiglottis will spread into the pre-epiglottic space, whereas your carcinoma ventricle, the other name of the ventricle is saccule, will spread laterally into the paraglottic space. Will spread laterally into the paraglottic space. So from supraglottis, glottis, subglottis, what is the most common site of carcinoma larynx? The most common site of carcinoma larynx. Excellent. It is glottis. From the pre-surface or medial surface of the vocal cords, this carcinoma arises. So most common site of carcinoma larynx is carcinoma glottis, which has best prognosis. Which malignancy has the best prognosis? Carcinoma glottis, carcinoma subglottis, carcinoma supraglottis, which have best prognosis. Why glottic carcinoma has the best prognosis? Is there any answer for it? There is least lymphatic. What is? Please mention your names also. Wonderful answer. 17807022. 17807023. 17807023. Again, Sneha, Chandra Kiran. Oh, one boy. After many days, I am seeing one boy answering. Okamagadu. Answer just next. Next, other names. Anybody? Happy to see that you are following the classes properly. So this carcinoma glottis, that is vocal cords, does not have a lymphatic supply. So there is no chance of lymphatic spread. So there is no chance of lymphatic spread. So it has a good prognosis. It has a good prognosis. Understood? Whereas carcinoma subglottis, the symptoms are rare. The symptoms are rare. Then because it is in the subglottic space, it does not cause symptoms like hoarseness of voice or stridor will be presented late. So it has the worst prognosis. Carcinoma subglottis has the worst prognosis. So one thing you must remember in the staging of the carcinoma vocal cord, if there is fixation of the vocal cord. What is fixation of the vocal cord? That the vocal cord is fixed. The vocal cord does not move freely. So fixation of the vocal cord comes into which stage of excellent? 7023. Okay. Name Kirana, Chandra Kiran, 7023. Excellent. So carcinoma larynx, you forget everything, but you don't forget only one important point. It's very, very important. In your lifelong, you must remember this one point. Other points, you leave it off. It is not important. Carcinoma larynx, if there is fixation of the vocal cord, it comes under the stage 3. Understood? It may be supraglottic tumor, it may be glottic tumor, it may be subglottic tumor, any tumor. Stage 3 comes under fixation of the vocal cord. So if there is fixation of the vocal cord, then the treatment of choice is you remove everything. You remove everything. That is pharyngo-laryngectomy, total pharyngo-laryngectomy. That you have to go for surgery. If the vocal cords are not fixed, if the vocal cords are freely mobile, then you can go for what therapy? Chemotherapy or radiotherapy? Excellent. You can go for radiotherapy. So in carcinoma larynx, only one point differentiates whether you can go for radiotherapy or whether you can go for a surgery depends on the fixation of the vocal cord. If the vocal cord is not fixed, if the vocal cord is freely mobile, but there is a tumor, but vocal cord is freely mobile, you can happily go for a surgery. You can happily go for radiotherapy. No need to go for a surgery. Radiotherapy completely cures the carcinoma larynx. But if there is a fixation of the vocal cord, then you cannot go for radiotherapy. You can go for surgery. Only this very, very important point makes a difference in the surgery, and only this point will change the staging. So T3 staging is the fixation of the vocal cord, and in T3 staging you cannot go for radiotherapy. You can do only surgery. You can go for only surgery. This is the important point regarding the carcinoma larynx. Okay, this is the important point regarding the carcinoma larynx. So fixation of the vocal cord means the vocal cord is not freely mobile. Why the vocal cord is fixed? It is because of the spread of the tumor to the recurrent laryngeal nerve. Recurrent laryngeal nerve spread will cause immobility of the vocal cord, or the tumor may spread from the vocal cord posteriorly to the cricoarachnoid joint. That it will be fixed to the cricoarachnoid joint. The cricoarachnoid joint is fixed. If the cricoarachnoid joint is fixed, the vocal cords cannot move freely. The vocal cord cannot move freely. So fixation of the vocal cord is because of fixation of the cricoarachnoid joint, or it is due to spread to the recurrent laryngeal nerve, involvement of the recurrent laryngeal nerve. So involvement of the recurrent laryngeal nerve, involvement of the cricoarachnoid joint means that the tumor has spread beyond the localized site, and we have to go for a surgery rather than radiotherapy. So remember, students, this is a very, very important point regarding the carcinoma larynx. In next class, we'll definitely discuss in detail regarding the carcinoma larynx. But at present, please remember this valuable pearls in the carcinoma larynx, so that it will be made easy for the next class. Okay. So next class, because this question is given as an essay for your seniors, so we can expect essay again for your batch. So please remember whatever valuable points I have told you. And somebody has written cisplatin. So cisplatin is a chemotherapy of choice for most of the head and neck surgeries. Most of the head and neck surgeries will use cisplatin as a chemotherapy. Okay. Any doubts? You can ask me. Any doubts? Any doubts, please? No doubts. So I can close it. Okay. Great. Okay. Thank you, students. Good answering. Stop.